Well, hello, everybody, and thank you so much for joining our session today. The impact of mass vaccination on the healthcare workflows of tomorrow. My name is Adam Mahmood, and I'm the Senior Product Marketing Manager of Healthcare at Jamf. And I am so excited to introduce the lovely customers and partners that we have with us today from UC Health in Colorado. First, Gwen Martinez, an informatics RN from Clinical Informatics team. Next, Ed Horowitz, an information architect, also from Clinical Informatics. And last, but certainly not least, Kyle Toburin, a desktop and mobility integration engineer from the Client Systems Infrastructure team. Today, we're going to be digging into a few core topics of a story of mobility at UC Health over the last year. First, we'll get a little insight into the overview and history of mobility at UC Health. But next, dig into the need for rapid change driven by the global pandemic. We'll dig into how the team found a path to success with mobile use cases around mass vaccination. And certainly last but not least, dig into what's next for mobility in healthcare. So with that, I'd love to turn it over to the team. Ed, take it away.
Thanks, Adam. Thank you, Adam. Appreciate it. So as Adam mentioned, we're UC Health. We're based in Colorado. We have over 12 hospitals that cover the state of Colorado, and including parts of Wyoming and Nebraska. We have just under 2,000 available beds that we see patients in, over 25,000 employees, and we see over 137,000, almost 140,000 inpatient admissions and observation visits per year. So pretty big gamut. We cover a big territory in an area that has a wide range of weather issues and other things that kind of affect how we can potentially give care and what we can do. So what I'd like to do is to give us come through there. There we go with the slides. So right now we have about over 3,000 iOS devices that we maintain. And our users include physicians, nurses, transporters within hospital, housekeepers, radiology, or food service employees. We cover a lot of range of a large different number of uses for these. E-signatures for consents we're using in our EDs and other areas. We use it for unified communications, and we use it for things such as like ultrasound studies and different kind of clinical applications. We're really seeing an overall integration of mobility into our workflows within the hospital. And I'd like to turn it over to Kyle Toburin here to talk a little bit in more detail about how we use some of our devices.
Okay, thanks, Ed. As Ed mentioned, we're strictly an iOS shop, and we have very few Macintoshes deployed, a few in the marketing department, less than 20 probably overall in our entire front range sites. And again, we use the iPhones, the iPads in all aspects of the healthcare. Even what's not clinical based facilities, all those kinds of things. And one of the things that's interesting is as quickly as mobility is moving, over the last 3 or 4 years, we're already into the process of some major upgrades and moving to different vendors. Our unified communication, VoIP communication, our ultrasounds are all moving to new vendors. Our transports have gone from a vendor to the Epic Rover application. And then as these projects fall by the wayside, these old projects fall by the wayside, Jamf makes it easy to reallocate all these devices to these new functions as we're just moving forward. We're doing this with new vendors, and we just don't need to buy new devices when we can just reallocate new equipment. We have really approximately about 1,200 iPhones, and the iPhones are mostly in the core clinical areas, and that would be the nursing stations. A lot are used for phlebotomy, the lab areas to go out and take specimen samples, patient transport, environmental services for room cleaning and so forth. And we use a basic shared model where all the iPhones look similar. They look the same, and that we leverage with that same look and feel across all the iPhones, the client systems aspects of the applications. Every application's Rover, the voice apps all require a login at the app level, so we don't really have to do a shared iPad or iPhone technology there. And we're not using the shared models yet. I know Jamf is coming up with some new shared models that we've been talking to them about, and we're seeing how we can put those into our environments. The iPads, we have approximately about 1,200 iPads deployed. And those aren't so much in the core clinical nursing stations. Those were being used for specialized functions. For example, translation services is a big one. We have a lot of iPads out there for translation services. Ultrasound is something we mentioned. Rehab, remote doctor to patient communication in a very critical or an area that we don't want a doctor going into a room. We can spin up an iPad and have the doctor work with the patient right there. Another interesting thing that we've started doing, I think is really kind of cool, is we're using iPads mounted outside the room as room signage, and that actually gives a dynamic status of what the patient's status is right there, and it's dynamically updated from Epic right there in real time. And so the nurse or family members can go right up and look at that iPad and see what status is of the patient before they even go in the room. I kind of think that's a pretty neat thing. The other thing, of course, we use iPads for is the patient side, the patient entertainment, and especially given the patient's ability to access their personal health charts. And we're using, of course, the Epic Bedside and our own My UC Health Connection app to let the patients see their own personalized health status, in a sense. And of course, then also is the entertainment aspect of the iPads. Since we're using the Jamf Healthcare Listener and the Jamf Reset, that gives the opportunity for the patients to make the iPad their personal iPad. And then on discharge, of course, the iPad is just totally erased, and all the personal information is removed. And then as far as Apple TVs, we only have about 200 deployed, and those are all in patient rooms. And currently we're using it just for patient entertainment, and that's to use AirPlay to move from the iPad up to the Apple TV, just to see whatever they might be using the iPad for right now. So anyway, so that's pretty much the way we use iPads and iPhones in our environments. And again, just very few Macintoshes and iPods are still out there. But we'll go to Gwen now for more detail on the clinical usage.
Thanks, Kyle. Well, as you can see, we were on this mobility journey and really exploring what we could do clinically with Apple products, and also having the ability to use different form factors for different use cases clinically. But then COVID happened, and with COVID, changed everything. We suddenly had this huge demand for more mobile devices for use at the bedside, for physician rounding, for family conferencing, for families to communicate with their loved one in the hospital during COVID. So we also had a use case for mass vaccine clinics. And with the mass vaccine clinics, we started planning well in advance of a vaccine being developed. We knew that a vaccine was being developed, and we started planning, what are we going to do? our really big initiative was to get as many shots into arms. Once the vaccine was ready to go, we wanted to get as many shots into arms as possible and possibly, end this horrible pandemic. So we talked about, where could we have a mass vaccine clinic, and who can we partner with in our community? Coors Field, the Rockies, Colorado Rockies baseball team, gave us a parking lot, and we started doing the plannings for a huge mass vaccination clinic. The other thing is that we realized we needed to partner further in our community with community centers and churches to deploy our vaccinations. So that was the start. And of course, it was a journey, trial and error. And we started planning well in advance and started thinking about what can we do with technology. So what we did was partner with Coors, like we said. We started planning, the logistics, with how many cars could we get. Our plan was to work up to 5,000 patients a day, drive through. We didn't want patients getting out of their cars. We wanted them to drive through, receive their vaccinations in a timely manner. We also didn't want patients backing up into our streets, our interstates, and also we didn't want our patients waiting for hours, in long lines, nervous, about whether they're going to get vaccinated or not. So we invited 5,000 patients, and we knew that the task was huge, but we needed to get people through as quickly as possible and with as much convenience as possible, so that they are not waiting and hoping. So the next thing we did was started creating the lines for the patients to come through with their cars. And we had planned on using technology. And next slide, please. Not only did we have cars, but we have patients ride their bikes several miles to mass vaccine clinics. So here is one of our patients who rode his bicycle that day. The first phase in terms of our planning of mass vaccines was we did a couple of smaller mass vaccination clinics with 1,000 patients, just to kind of work through logistics, to work through some of the issues and make sure our teams could perform and get patients through. So our first phase, we had paper. Believe it or not, we thought we would use paper documentation. And what we were planning to do was having the nurses write on a piece of paper, what shot they gave to the patient in terms of which arm they gave it in, and the screening questions that we had. These mass vaccine clinics were in January and February in Colorado. So of course the weather was, probably not ideal. A couple of our clinics, we had sub 20-degree temperatures, and writing on paper, we soon found out, was not ideal. Not only from the ink being frozen fingers trying to write on pieces of paper. And then the other thing is that the documentation was not always accurate. Legibility became an issue, accurate information, and then the pressure to get patients through. So we learned quickly paper was not the way to go. We even thought like paper, and we had runners running the pieces of paper back to a documentation tent where we had several analysts and people who are really good in Epic document what was administered. We quickly fell behind. We were behind an hour and a half. And so we realized with the legibility, the inaccurate documentation, that this model was not going to work. So we started working with Epic and to use Rover, and we wanted to use the iPhones and give the iPhones to the nurses to document real time as many patients as they could in Rover, and have as accurate documentation as possible. So once we decided to use more technology and try to do real-time documentation, we had challenges of infrastructure. And so now I'm going to turn it over to Ed, who's going to talk about some of those challenges and how we met those challenges.
Thanks, Gwen. So, yeah, the big challenge moving over from paper, as Gwen mentioned, was we needed to set up a network. We needed to figure out how we are going to best accommodate all the iPhones, some of the iPads, and a few WOWs that we were using. We went through a couple of different iterations. We started using Meraki's to actually broadcast the signal over the parking lot. We ran into some issues, including interference and just not great coverage. As you saw from one of those, I think, slides, it's a pretty wide and long parking lot, and we have a tent that comes in, and we needed to set up different kinds of generators, different kind of ability to really broadcast our signal. And we also knew that since we had, great numbers of people coming in with cars, we couldn't. It's not something that if something went wrong, we could just kind of bypass or skip that day. So we needed a number of backup solutions in place. So it was a complex undertaking in terms of considering the weather and all these different things. So one of our backups was within our iPhones. We actually had SIM cards that we made, and partnering with Verizon in addition, we're able to use the 5G network as a backup plan for either if the cell coverage didn't carry to that area or the network went down. So that was involving the setup with the SIM cards, the cell plans on the different phones, having our laptops and WOWs in limited fashion for when there were issues that couldn't be solved immediately within the tent. In order to make everything move fast, the cars would pull off to the side if we had any other issues. And we also had some different iPads that we needed to use to go through the ability for our language line services. We needed them for the interpreter services. So we did configure iPads and iPhones, as Kyle mentioned, through Jamf Pro with our Apple configurator. We were able to auto-populate all of those and basically give the nurses, physicians, and other staff that are supporting kind of a consistent, familiar device, so they could kind of go through this 1, 2, 3 to minimize the amount of time that patients spent to maximize our ability to kind of get them through that system. So I'll turn it back over here to Gwen to talk a little bit more about Epic, Rover, and the mass vaccination workflow.
Thanks. Once we decided to use iPhones, we partnered directly with Epic. They were already building mass vaccine workflows in Epic Rover, but we helped co-develop with them in terms of more efficient processes. One of the things is when we gave a nurse a phone, we wanted to make sure that they could check the patient in, ask the screening questions in terms of, are you feeling well today? Are you feeling sick today? Are you allergic to vaccines? Those were the screening questions. And we wanted to make sure that they could scan the medication and document which arm they gave it in, and also all the product information. The last thing we wanted the nurses to do was to review the documentation after they had administered the shot to make sure that the documentation was as accurate as possible. And then the final piece was to check the patient out for that visit. So then the data is available for the patient to review later, and it's the clinic visit is closed and ready for review. Patient instructions, once you close the visit, are also available to the patient in their virtual accounts with UC Health. So we thank Epic profusely for working with us to make it very easy. And if you could see the slide here, this is our build with the check-in. You scan the patient's barcode, and that opens this screen, and then they check in the patient. They also review allergies and then start by tapping on the medication that they're giving and then asking the screen questions, finally giving the shot, and then reviewing the data and closing the visit. And this tremendously brought down times for the patient in the clinic, from actually driving up, checking in, receiving a shot, and then driving to the observation area. So what we found was that the iPhone was our primary tool for our vaccinators. We cut down time from 3 minutes and 30 seconds down to 75 seconds with that interaction, and we kept the lines moving. It was wonderful. After the first, trials that we had, we were, trying to make sure people were connected on the network. We were trying to make sure patients moved along. But once we started using the mobile solution, there was a time where Ed and I were standing around just watching the flow of patients, like a river of patients just driving through, receiving their shots, thanking us, and moving on with their day. So it was really wonderful to see that, and again, very fulfilling to be able to get as many patients as we could, 5,000 patients in a span of um, our clinics opened from 8 a.m., ended at 2. So again, we didn't want to have our staff there all day and all evening, all night. We wanted to have, shortened clinic hours and then get as many shots into arms. So with that, we learned lots of lessons with mobility. We saw lots of efficiency, and we know that mobility is the way for us to go. And in terms of our future projects, we have lots of demand in terms of people asking for mobile devices in clinical use cases. But what we learned here, was that mobility definitely has a place in our healthcare environment. And so this slide, we're talking about what the impact of mobility and what it has done for us. My picture above here is that the old way of doing things, we had a WOW, then we had a barcode scanner, we had people with pagers, then they also, on top of the pager, had a mobile phone, which was not a smartphone, and then a camera. All of these tools are used by nurses and clinicians every single day. And what we found out is that you can do all of these functions on an iPhone. And so with a smartphone, you have your camera already built in. You enable VoIP calling, you can communicate. And we are working on also eliminating pagers, because when you page a physician, you're not sure sometimes if the physician's got the page or not. There's no read receipt with paging. It goes out and you wonder, and you hope that patients, the doctors will get the pages and call you right back. Barcode scanning medications enables safer patient care with making sure that you have the right patient and the right medication. And so nurses oftentimes use these tools. And what we found with an iPhone in your pocket loaded with Rover, you can take pictures of wounds. You can instant message providers and see that they have read your message and communicate much quicker than the old school paging. Barcode scanning medications is also available in Epic Rover and on our smartphones. And so what we found is that sometimes patient care is addressed much quicker. We can get patients to treatment much, much quicker than in the using older tools. So what we found in using Rover and a smartphone is that we don't need all of these to purchase all of the above tools separately. We can just use the smartphone. And when we started looking at reducing the WOW count, we can reduce, in med-surg areas, we reduce our WOWs 4 rooms for 1 WOW. So before we had a 1-to-1 patient room relationship, we've been able to cut back on our wows and give the nurses this wonderful tool. So now I'm going to turn it over to Ed again, who's going to talk about our latest iteration of projects, that use cases that people have come up with, and some of our newer solutions that we'll be deploying soon.
Thanks, Gwen. So there's a number of mobile projects that we have that we're moving forward with at UC Health. So it includes using Lumify, the Lumify app for mobile ultrasound appointments, Patient Safe for VoIP calling, linking with Epic Rover on iPhone. As Kyle mentioned before, patient room signage on an iPad, which resides outside the room and eliminates the need for sticky notes or other non-functional bits of information, and also is better information for the nurses and staff, including information about fall risk and things like that. We're also have a digital whiteboard that we're working on that has the patient care plan and a treatment team. That's actually, and that's what you see in the picture here, it's actually part of the TV and will be built in the future with Apple TV. So there's multiple plans. We're working with Jamf and Apple to kind of move that forward in ways that we can integrate some of our existing technology, and also as we kind of move towards the future. And one of the things that I think that we wanted to leave you with is that there's nothing good about COVID, and we're still living that nightmare. But one of the things that I think it did was to make us all kind of take a good look at what we were using technology-wise and how we could maybe move forward in a quicker sense and use some of what we've learned using this situation and push things faster and further than we might have otherwise. And I think it was a challenge that we were all presented with around the world, and at UC Health, I know we took that and tried to kind of move things along quicker so that we could help patients, reduce staff having to go into the rooms with patients, and actually just provide better care, which is for our patients, which is the ultimate goal for us and certainly for all of us. So appreciate the time. I'd like to turn that back to Adam, and we appreciate you guys listening.
Ed, Gwen, Kyle, thank you all so much for not only spending your time with us this morning, but more importantly for the rubric of success that you've put forward here. I know that UC Health has a playbook for mass vaccination that's available on the website, available for other institutions that want to learn from your success. I think here what you've really shown from the informatics and IT perspective is where the rubber meets the road, so to speak. No pun intended, given this is a drive-up clinic. But, as to how these pieces of the puzzle really come together. So thank you a million times over on behalf of Jamf, because whether it be inpatient virtual visits, as you mentioned, Ed, or the use of iPhone for mass vaccination, we learned so much from you about the use of our product to help healthcare organizations succeed with Apple. So thank you, thank you. To the rest of you joining this virtual session, please check out the rest of the healthcare track at JNAC. You can scan the QR code on the screen or visit the link, jamf.it/JNUC21-healthcare-track. Thank you all and have a great rest of your morning.